with powerful evidence from the Dunedin study and now with what the British Medical Psychiatric Journal has published. Children who have ADD, that can't manage anxiety, can't manage impulse control before the age of 12, guess what? They ain't going to live as long. If that persists into adulthood, oxidative stress. Google it. Oxidative stress. Lifespan and health span. 3 words.
Have to make sure that we're treating the child as a whole and not just a maxilla. All right, the biggest problem is there's no one on earth who can't expand a maxilla. But if we don't marry up the mandibular arch to retain a functional occlusion, then it's just literally a waste of time. As dentists, we're obsessed by gadgets. We're obsessed by appliances. We're obsessed by stuff that we can make. What we've got to do is understand that a child's posture, how they fight gravity in this existence, is something that the parents can help when they raise their children. And it's up to us to teach parents how to improve the general oral posture and the nasal posture of a child.
Dentistry makes a living at fixing a completely preventable disease. Tooth decay was not a problem throughout human history. We've gone 300,000 years with no cavities, and malocclusion only 400 years old. So we go 300,000 years with no cavities and no malocclusion. We've got an industry, Simon, and you and I are pissing people off.
All right, welcome everyone. Good evening, good morning if you're dialing in from Australia. I can see there's about 100 people so far. We've had over 500 registrants. Hopefully we'll get a couple of hundred, and the rest of you will be watching the recordings, which we'll send out hopefully tomorrow. Welcome, Shushma from Vancouver, and we've got Donna. Welcome. Kevin White from Kentucky. Karen from Michigan, Grand Rapids, welcome. Bruce from Sin City, Las Vegas, welcome, Bruce. John from Tennessee. Who else do we have? Hillary from New Jersey. We have an international group. Interdeep from Ontario. Anyone from outside of the US? I'm in New York. Hey, Kevin, good evening. Good to see you again, of course, and my brother, Dr. Simon Wong from Melbourne, Australia. They're all here getting ready. We'll just, I think, get started any minute. We're already spot on 9 p.m. Eastern, New York time, 8 p.m. Central right now, for those of you joining from the East Coast. Very excited to have our very special guest, Dr. Kevin Boyd from Chicago. And my brother, Dr. Simon Wong. I'm Kian Wong. You've probably all been getting texts and emails from me from Postural Orthodontics headquarters, one of the headquarters in New York. My brother's based in Melbourne, Australia, where we grew up. What are we doing tonight? We're very excited to discuss something very dear to our hearts. Let me just share my screen, if I may. Controversies surrounding early interceptive orthodontics. Dr. Simon Wong and Dr. Kevin Boyd. And Kevin sent us a whole bunch of research papers. Very exciting. We're going to share it with everyone. There's over a dozen papers that he sent and articles on how we can optimize our children's health and lifespan, which is why we're here tonight. Firstly, Kevin, welcome. Simon, welcome. And welcome to the hundreds of you who are joining us from around the US and around the world. Today, it's a preview, as mentioned in the registration page. It's a preview of our 6th annual 2-day intro to our early interceptive postural orthodontics program for airway-focused dentists, especially, if you want to help, children in that 4 to 10 range. This year, we're going to be having it live streamed via Zoom, so you can watch from the comfort of your home on Friday and Saturday, June 6th and 7th. starting a little bit later in the day, 5 p.m. New York time to midnight, 7 hours both days, or 2 p.m. to 9 p.m. for those of you on the West Coast. For those of you in Australia, it will be starting 7 a.m. That's where my brother will be beaming from, Saturday and Sunday. So stay till the very end. I know a lot of you guys have been asking about this event, and we've got a very special, final offer, early bird tickets for the end of April. That we'll mention at the end of tonight's presentation. So who do we have as our main host? I'm going to pass the baton over to my dear brother, Dr. Simon Wong, who's the founder of Postural Orthodontics and the co-author of GOPEX, Good Oral Posture Exercises. Dr. Simon Wong is the principal of Natural Smile Center in Melbourne, Australia. Is focused on early childhood craniofacial development and malocclusion correction. He's one of the world's leading experts in orthotropics, facial growth guidance, and we're just simply coining his protocols early interceptive postural orthodontics, which is evidence-based and much more suitable for a wider adoption. It's created a unique set of lower and upper arch expansion plates and GOPEX, good oral posture exercises. He's got hundreds of cases that are currently being researched at top dental universities around the world. And you may have seen him recently on Netflix's Open Wide documentary. Simon, welcome. Are you there?
Hello.
Welcome. Are you going to introduce Kevin formally for us before we
Well,
get started?
we're very lucky to have Dr. Kevin Boyd grace us with his knowledge and his presence in our June event. He will be one of the keynote speakers. Kevin is a board-certified pediatric dentist with 2 decades of experience. He's very much focused on health care for infants, children, adolescents with disabilities and special needs. He has done much in the way of research in tooth decay, obesity, and type 2 diabetes. And he has very much focused on nutritional management for children's health. One of the things that he has been recently focused on is his combined work of his clinical practice in Chicago for diagnosing and treating interferences to normal growth and development, and most recently looking at research in what we would call the lifespan and health span of young patients, children within the community. So thank you for joining us, Kevin. I understand you're also going to be speaking in Malaysia in the upcoming conference, Integrative Airway Summit. And I think you and Sharon Moore will be talking about how growth and development, airway affects the rate of biological aging, oxidative stress, and a lot of the basic health sciences, physiology and biology. So we're very, very fortunate for Kevin to also share this information in our June event for those who can't make it to Malaysia.
I'm going to sign off and leave it to you guys. I'll be back near the end. Cheers.